everybody
It'll
gains a bunch of weight, then they want the GLP-1. They want to just take a shot. It's crazy to me. It's like, okay, do you know the side effects? What if you get gastroparesis? What if you get
yeah.
thyroid cancer? What if you get pancreatitis? All these things can happen from these drugs. Doctors don't usually tell you that. Most pharmacists won't tell you that. And then you're going to pay $1,000 a month. You're going to inject yourself with this stuff. And when you stop taking it, you're going to gain all the weight back because you never changed anything.
Yeah. No, I have friends who that's their drug now. They have to take it. Otherwise and that was probably the goal to begin with, right? When they were selling it. Like, we
Well,
got to
then
get
and
people
then
hooked on this for life.
it makes you not hungry. So are you getting enough protein? Or are you just losing muscle mass? Is your weight loss because of muscle or is it because of fat? Because there's a big difference between those two things.
Yeah.
You
I've
start
seen it
losing
age
muscle,
people.
your
It's real trouble.
metabolism's going to tank.
Yeah, because those are thirsty cells, right? They suck
That's
up
right.
all the
Yep,
glucose.
exactly.
No, I've seen people. I think they call it Ozempic face, but there's a
Yep.
lot of people. It really ages them real
Oh,
fast. So
yeah.
it's a Faustian bargain, right? It's like, okay,
It's,
you're going to be skinny, but it's going to add 20 years to your
yes,
face. So
that's
I
what
wonder if that's
happens to them.
reversible. Do you think it's reversible? Probably,
Well,
right?
yeah, because I think it's just all the fat
Start
that just
eating
leaves their face.
healthy.
You know what even happens to me if I lose too much weight the good old fashioned way? My face gets sunken
Start
in
start looking a
and
little gaunt.
I look old, you know? So,
Got to have
yeah,
those baby cheeks.
we
Stay
could have
on
a
it.
whole podcast just on GLP-1s. I
maybe
mean,
maybe that'll be the next one because I actually don't know that much about them.
oh,
I've just uh, I've just been following what other people have said and things. I haven't done much research into them, and I imagine it'll be similar to fen back in the day, right? Where all these lawsuits are going to happen, and
yeah.
who knows if it's going to end up being um, outlawed eventually because of all the horrible things it'll do to people 5-10 years down the road. But
We don't
now they've
know.
got a huge sample size. I guess we're about
That's
to
right.
find out.
We are.
We're
Yep.
going to get some statistically significant data one way or the other
That's exactly right.
real quick.
Yep.
Well, hey, thanks so much, Michael,
Sure.
for talking with me and doing the podcast. And I want to put a link to your social media in the description below.
Okay.
But where can people find you?
So I'm on TikTok, pharmacist_Michael, and YouTube, same name. TikTok, I usually go live 3 to 4 times a week, usually in the evening, sometimes in the mornings, but
Wow.
usually in the evenings. And I answer people's questions about everything. I mean, people ask about their drugs, they ask about supplements, they ask about sleep. GLP-1s are a huge topic.
Wow.
YouTube, I do more longer form videos on different drugs, different supplements, sometimes disease states. I actually have one coming out today just on GLP-1 supplements. And is there really such a thing? The closest thing is berberine, but is berberine really as good as a GLP-1? And, it's 11 minutes long. It's definitely worth watching if you
That's
believe
awesome.
a lot of stuff that you see on TikTok. I try to teach people reality, right? Not hype, because there's so much hype in the supplement space. There's so much, and there's hype in the drug space too. You know,
Yeah.
there's
Oh,
there's
definitely.
no drug that doesn't have side effects. It's all about risk versus benefit. So if you're going to take something, if you're an insulin dependent diabetic and you don't take insulin, you're going to die, right? That's one end of the spectrum. But if you need to lose 10 pounds, should you really be taking a GLP-1 to do that? I would say no, because I think that the risks are too high. But it's really up to the doctor and the patient. But I try to give people information so they can make a better decision.